Good morning to the Brownville Memorial Hospital staff. My name is Bianca Ramirez, and I am the new Director of Performance Improvement for Brownville Memorial Hospital. At this time, I will be speaking about a training workshop that will address how to improve health literacy. First, let us define health literacy. The real definition of health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. My own health literacy definition is the extent to how people are able to translate health information and services to make their own health decisions. Now, the two areas of concern that will be addressed is the one, utilize patient-friendly health education materials and disseminate them for patients to take home. The second is help patients to remember how and when to take their medications. Why these areas of concerns are important. Adults with limited health literacy are less likely to ask their medical provider questions. Misunderstanding their medical providers will lead for them not to understand their medical diagnosis. If patients do not understand their medical diagnosis and do not understand the information that their medical providers are telling them, this will impair the patient's health decisions and impact their quality of health. Also, people who do not take their medications jeopardize their good health, and it also costs a lot of money to the healthcare system if patients do not take their medications appropriately. And also, patients that take their medications appropriately will help them prevent serious health complications and even death. And therefore, patients oftentimes do not understand the instructions for their medications, which is a huge problem. So what is the nation doing, or what other policies and interventions are out there? So there is a national action plan to improve health literacy. This brings together organizations, professionals, policymakers, and others to collaborate together in order to improve health literacy. The National Institute of Health, NIH, has launched their Clear Communication Initiative, which is accessible to the audiences and is culturally respected. This incorporates plain language content and new technologies. The NIH came out with their Pink Book, which is seen below, that talks about health literacy strategies and is provided to anyone who downloads it. Lastly, there's a healthcare literate care model that medical providers can follow. It's for self-management support, delivery system design, and clinical information systems that will improve the health literacy between medical providers and patients. Key communication principles. It is important to use visuals because visuals make the context for patients easier to understand and to follow. And visuals also reinforce the written information that is already stated, and visuals help patients understand the main message by having bullet points and clear headings, labels, and captions. Sentences should be simple and short. Medical providers should speak slowly and clearly. They should be positively and supportive. They should use plain language, as mentioned before, bulletin points to make it easy to follow, and they should use the teach back method, which allows patients to teach the medical providers what they initially told the patient. So the methods align to the chosen issues. So prescriptions, the instructions for the prescription should be written in more simple and short. There shouldn't be no medical jargons or wordiness. It should be in plain language. There should be a main message, clear headings. Anything important should be bolded. Also, the health materials that are provided to the patients should be translated in multiple languages. It should include visuals. Medical providers should use the teach back method when they diagnose their patient and when they tell them what medication they're being prescribed, in order for the patient to really understand the reason why they're taking this medication. Some recommended best practices. So it is important to begin from the top and educate stakeholders in health and human services, or the Department of Education. This will allow to focus towards health literacy through public health and the healthcare system. So it would be both working together. Some things that healthcare providers should avoid is using long descriptions for medical instructions. They should avoid medical jargon, avoid a passive voice, instead use an active voice, and any health materials that are provided to the patients, they should not be too complex. They shouldn't have new words that the patient's not comfortable with, or new concept. And if devices are provided, they shouldn't be too complex. Some other recommended services include having the ability to use the language access services, LAS. This way patients are feel more comfortable having the health information, medical diagnosis being explained to them, because it is being explained to them in their own language. And as mentioned before, the teach back method is a very effective intervention for patients to remember what they're being diagnosed. Some ethics that should be kept in mind is for medical providers to understand which race ethnic groups they're speaking to. Perhaps patients may have a question of why the certain disease runs in their family, and medical providers should be able to explain that to them, where they can understand why it may be more prevalent in certain racial ethnic groups. Maybe perhaps provide them with health statistics that can relate to the diverse patient group. And as I mentioned before, the health material should be translated for the patient, or the medical provider should provide the patients with the resources with resources where they can obtain that information. So the exercise that I chose to teach is the upside down bottle exercise. So in this exercise, 15 medication bottles are going to be used, which is the average medication bottles that an elderly person at the age of 81 has. Participants are not allowed to take their medication until they understand how to take it. So participants will have 15 minutes to rewrite the instructions in the medical bottle until it is in plain language. Participants will turn their bottles upside down once they have taken their medication from the bottle. So the purpose of this exercise is to distinguish that you've already taken the medication from the bottle and to remember that you have taken the medication, as well as understanding what medication you've taken. Key areas of concern. So the upside down bottle will be a form of technique that will help the elderly remember to take their medication. And also, health literacy is difficult for elderly, so the purpose of turning over the medication bottle is for providers to rewrite the instructions in plain language for the patients. This will help address to use patient-friendly words in order for them to understand the instructions better. So the materials needed for this exercise are the 15 medication bottles, table where the medication bottles will stand, sticky notes to write down the instructions, and the time, pens, and the timer. So the following are the steps of this exercise. Step 1, 15 participants will line up in front of a table. Step 2, 15 medical prescription bottles will be placed on the table facing the participant. Step 3, each participant will have one medication bottle. Step 4, sticky notes will be placed in front of the medication bottle. Step 5, pens will be placed on the right side of the sticky notes. Step 6, timer will be placed for 15 minutes. Step 7, on go, participants must rewrite the instructions from the prescription to how they think patients will understand. Step 8, when they are done writing, they must put the bottle upside down and pretend they took the medication. Step 9, on stop, participants must stop revising the instructions. And finally, for step 10, each participant will assess each other's written directions to ensure it is written in plain language. So the end state of this exercise, the anticipated result is to establish a protocol to show patients how they will take their medication and help them understand the instructions from the medications. The expectations is to patients understand the new version of the instructions from their medical provider. It's expected to decrease drug-related adverse effects. And finally, expectations is for medical providers to establish simple instructions in 15 minutes, since that's the average time medical providers meet with their patients during appointments. And these are my references. I hope you all learn the importance of health literacy and the importance of improving health literacy and the current movements that are being launched to improve health literacy nationwide. And I'm hoping we can all use these techniques and this exercise to make patients feel more comfortable about taking their medications and remembering, as well as helping them understand the health materials that are being printed for them so they can take home. Thank you so much for listening to my presentation.